Hey, Dr. Rowland, how are you doing this morning?
I'm doing super fantastic for a beautiful Saturday, Las Vegas. The weather is absolutely just stunning, blue sky like the ocean. Absolutely gorgeous.
Wow. Well, you know what? It's really nice here on the East Coast too. Very, very cold. But I wanted to catch up with you because there's a lot of things going on. And I think you and I need to have a conversation. You good with that?
I've always loved having conversations, especially when we have the opportunity to make a difference in people's lives. And so let's have that what we call that good mission on task hard conversation.
All right, Doc. Here we go. You're right. It's kind of hard. So, Doc, I'm going to lead with this. You know, not long ago, I was sick and came down with COVID, kicked my ass. And then we discovered that the COVID doctor, infectious disease, pathologist, virologist, all the things Dr. Rowland ass came down with COVID. Let's get into this. What is going on, Dr. Rowland? You came down with COVID.
Well, like I told everybody 2 years ago, even in the back of my mind, that we were all going to get exposed. Everybody's going to be exposed to the Omicron version of the coronavirus. People are going to be exposed to the coronavirus family, alpha, beta, gamma, and I was exposed, and it was a hell of an experience. I think I was exposed initially back January of 2 years ago, but this time around, this was no experience I've never had in my life, being exposed and coming down with the SARS-CoV viral infection. So it's been really uh, uh, another experience in life, because I always tell myself, when you go through the experience and you can articulate to help people, guide people on how to get to the other side. I've had dengue, I've had malaria, I've had some of the most severe viral enteritis diseases in the world, where you're having, 5 liters of diarrhea every 30 minutes. So me being exposed to the coronavirus, it gives me a different perspective on really how to navigate and get to the other side. So a hell of an experience, but like I always say, doctors get affected too. Doctors die too.
Yeah. So, Doc, first of all, I'm so glad that you're able to be here still with us talking about this, telling your story. But the first thing I noticed about you is the weight loss. So I know, like, this virus, like it does a lot of things and it trim you down. So can we get into like how you're feeling now? I don't know how long it's been, but how are you feeling now,
Well,
post COVID?
I think for me is probably about day 15 into the initial affection date. I went through the whole gamut. I mean, my God, I've never experienced anything like this in my life. From the shortness of breath, the fatigue, the congestion, the phlegm with blood in my sputum, out of my nose and out of my lungs, severe gastroenteritis, diarrhea, for 8 days straight. I mean, just severe exhaustion and stuff. And I got to a point where, I mean, seriously, I'm sitting up here in the back of my mind going, this is going to be incredible. Here I am, the top guy on the planet, one of the top guys on the planet. Here I'm going to die from COVID because at 2 o'clock in the morning, I couldn't breathe. And I'm taking every medication because I have all the medication. I'm taking dexamethasone. I'm taking the antibiotics. I got a pulse oximeter, etc. And my O2 sat going from 95 down to 70, 68%. 2 o'clock in the morning, I'm sweating. I have to take off my shirt, put the air conditioner down 50, praying. I'm hoping I don't get to my accessory muscles. I'm puffing like a fish, trying to breathe and stuff, praying to God I make it to the next day, the next morning.
All right, now, Doc, you get COVID and you begin to really think about mortality. You really start thinking about, are you truly going to make it to the other side? Since we know that this virus is so interesting and it really has no respect of person, and it just does what it chooses to do to the body. Was there a moment that you laid there thinking like, hey, I may not make this for real. Like, this may not happen. And how did you handle that if you did think about that?
Well, I think the reality, I did handle that. It was a probably one of the first thoughts in my mind. Here I am, I'm not, I mean, here I am, I'm pretty good shape. I know how to navigate in this space, and I could tell it coming on. I could feel it. I had my little, I call it the COVID cough, and then
Mm-hmm.
COVID fatigue. Then I became a little bit more sleepy, and I didn't have the energy. My energy went down from 100% down to 10%. Well, hell, I couldn't even walk 10 or 15 feet. And when you, and trying to figure out what is going on, but I already knew what the answer was. I knew I was infected with the virus, and everybody has different reactions and stuff. That famous word trophism. And I'm looking at, well, I'm trying to do the analytical thing. What virus, where the virus, what cell did it affect? It affect my nose. I can still smell, I can still taste. But man, it's affecting my lungs because I got upper respiratory infection. I can't breathe. I have phlegm. My O2 sats going down. And at about 1 o'clock in the morning, I'm going, my God, I mean, I can possibly die. And I don't want to be a victim to disease that I'm the expert in. And so I started thinking about my mortality. I was praying to God to get me to the other side, get me to the mark the next day in the morning. Please, God, let me breathe. I mean, I couldn't even lay down on my back, on my side. I couldn't sit up. I had to stand up to breathe. I had to sit in a chair to let my lungs try to do the best they can. I'm breathing through my stomach, trying to get that air in my body. So I completely understand. And I already knew what the significance of having the SARS-CoV virus respiratory infection and having that thought in your mind, the mortality and dying is always present. And that is the game changer when it comes to disease. We all have the possibility of dying, and a lot of people will die.
Oh, Doc, my heart goes out to you because I had my own battle, so I get it. I get it. It's surreal, but we've always known it was surreal. It's not that we didn't know. It's just different when it actually knocks on your door. So with that being said, you've talked so much about situational awareness, our hands, our cell phones, close proximity to people and things of that nature. Um, how now will you move, understanding that no matter what we've done, everything we've done, we've created all kind of bubbles, and that one little time that we may let our guard down, this happens. How do you think you'll move in the future, in this Omicron space?
I think for me, I'm going to still move the same way I've been moving. I've been moving very well. Situational awareness, how to travel on the airplane, how to function around people. Where was my exposure? I don't know if was I exposed in Mexico? Was I exposed on the airplane in first class? Was I exposed in Atlanta? Was I exposed in an Uber taxi? I don't know. But what I am going to do is continue to practice what I've always preached, is having the best biosafety bubble around me. I'm going to continue with the best mask. I'm going to continue to do everything, because this is the deal, folks. Even though you get infected like I've been infected, you can get repeated infection. And I do not want to get a repeat infection, because we know that if you get a repeat infection, 30% of the people are dead within 60 days of getting another infection. And so you're already a compromise. You're already immunocompromised. You've already lost a percentage of your cells in your body. So you can imagine getting another infection that downgrades you a little bit more. And the reality is that this is our new norm, is that we have to prevent ourselves from getting repeat infections. So my game's going to even be better than it was, because I've already gone through it, and I don't want to go through this ever again in my life.
Oh, Doc, I totally agree with you. It is no fun. So anyone that's watching, anyone that's going to hear about this, I think, yeah, they must know it is no fun. So they have to really be careful. But, with everything that, you did to remain protected and keep yourself safe and keep others around you safe, it still come on you. So maybe there's a lesson in it all for those that may wind up contracting COVID. And if so, what is the message for them? Like, what can you did a lot to stay safe, and you had a lot of access, and not everyone has access. And, when I shared with you what I did and how I took care of myself.
Right.
So any suggestions for those that will watch this, as how to, like really maintain whenever they do get this diagnosis? What are some of the things that they should do? Some of the things even that they should not do
Well,
as it relates to COVID?
it goes back down. I'm going to be more vigilant now. I'm going to have the best mask. I'm going to make sure my hands are not touching anything. They've already weren't touching anything. I'm gonna make sure that I decrease the possibility of me getting infected by other people by maybe not going to these restaurants and having a meeting there, or going to a meeting and you let your guard down because you're in a meeting with some high level people. These high level people might be the people that are going to transmit that disease to you. So I'm going to practice the best biosafety. I'm going to make sure I continue not to wear my shoes in the house. I'm going to continue to wash my hands with antiseptic soap. I'm definitely going to continue to have the best air purification units and stuff. And what I would recommend for people that have gone through this thing is that you need to upgrade your game. And one of the things I found through this process is that, in Peru, in my house in Peru, I have 2 oxygen tanks because of the high altitude. Every time I go back to Cusco, it's 11,000 feet, I can't breathe. I'm telling everybody now, if you're going to navigate over the next 5 years in this space, and the Omicron and all the different, you better get yourself an oxygen tank for your home, period, end of story. Why? Because at 2 o'clock in the morning, I wish I had an oxygen tank because you're not going to be able to go to the hospital and get on an oxygen tank because there's no oxygen tanks. There's no oxygen left because everybody's on oxygen ventilation. So this is prudent situation awareness. Invest money, get an oxygen tank in your house just in case you get sick and you need that oxygen supplementation. You can do it at home and make sure you have dexamethasone and the antibiotics and all the stuff that you have, but upgrade your game.
You know what, Doc, I think you're onto something. The steroids and the antibiotics was a lifesaver and a game changer, personally. So I'm glad that you were on that. Now, I want to pivot a little bit, just real quickly, just ask this question regarding, how does one know the real toll that COVID has taken on their body? Is there a particular checkup that going forward that we can ask for, or we can request our doctor kind of take a look at? What are your thoughts on that? Because some of us, it affects all of us differently. And so that person that may have the lung issues, right, the breathing problems when they contract COVID, how do we then go forward and say, hey, doc, can you check my lungs and see how they're operating? Like, what do we say to a doctor?
Well, I think you have to address each functional problem that you have, i.e. for me, and one of the things I love about my life is that I am the epitome of real-time situation. I am the guy, the boots on the ground. If I tell you something, I've done it. If I told you I've jumped out of helicopters, I've done it. I've gone through this COVID Omicron experience. I know what it takes. And for me, my complication right now that I'm having is the breathlessness. I get fatigued very quickly and stuff. And then the article came out today, talked about this is a big complication for people that get COVID is the breathlessness. And we look at the lungs, and the lungs are really looking functional, but they have what we call epithelial damage, and it gives you that shortness of breath. So you have to get an MRI. So I'm going to be dealing, for me, over the next month or so, my thing is going to be the ventilation rehabilitation, trying to get my air back where I'm not talking for 5 minutes and I decompensate and I have to compensate for that. So my complication right now is my air system, the breathlessness, and trying to get my lungs functional again. And we're going to see over time if I get that back. But for each individual that gets infected with the virus and whatever the complication you're having, Lynn, you need to take a hard look at that. If it's getting a secondary opinion, finding out why you have gastrointestinal problems, figuring out why you have erectile dysfunction, whatever the case is, kidney problems, maybe become a diabetic. You have to address each individual complication as it is on.
Hot dog. And I know that you are an avid boxer. You get in the ring, you do your thing. And I can't imagine, like what it's like for you to be, dealing with this whole breathing situation, knowing how much you love to get out there and get your, your workout in. So I'll know you're much better when I see you back in that ring, hitting that, hitting that bag and hitting those folks on the other side.
Like
So
Coach John wanted me to come today at 2 o'clock and work out. I'm like, man, if I wouldn't work out, I'd probably have a heart attack because I don't have I don't have the lung capacity to do it. And you're absolutely right, because I'm some guy, I mean, I'm talking airborne, trained, recon, ranger, SF, Pathfinder, all that stuff. I've been a high level athlete my whole entire life. And here I am, I catch a virus, and it's made me go from a professional to the minor league. And I'm going to have to get myself from that minor league back up to the pro. And this is why it's so important for everybody, whatever the level that you're at, you're going to have to navigate from that. And that has to be your baseline. And you're going to have to build back to that. So my goal over the next 3, 4, 5 months is to get my lung capacity back to where I can do my Muay Thai and do the things I do. But I'm going to also make sure that I protect my life by making sure I continue to have great biosafety security protocols, the masking, the hand washing. But I'm going to go ahead and add an oxygen tank. In fact, my oxygen tank came last night. So I got an oxygen tank at my house. So anytime I get short, I'm going to suck on that oxygen. And everywhere I go, I'm going to take a little portable oxygen with me just in case, so I can have that oxygen that's going to help my lungs and help me with my rehabilitation. So this is part of that being aggressive, being proactive in my actual care to get me back where I used to be at, because I'm going to come back. But the most important thing is that I'm alive. God gave me the ability to be alive. And as long as you have the ability to be alive, you have hope, you have opportunity. When hope and opportunity gives you life to continue to push forward in this world.
I couldn't agree more, Dr. Rowland. Now, listen, I'm not going to hold you up too long today, because I know that you are traveling and you do have some things that you have to get done and taken care of. But I wanted to take an opportunity just to talk with you and get just kind of talk about this. This has been a hell of an experience. I think for all of us, but me knowing you and looking at you and watching you and being very concerned about you, I wanted an opportunity for you to, now that you're able to really share what these last couple of weeks has really been like for you.
I think the important thing, Queenie, is that people have to see it. They have to understand it. They have to have people like me that have the real world experience, not just in infectious diseases, but actually contracted diseases, to be able to tell people this is what it's like and give people the best management, the best information to save their lives, so we can move in the future and stuff. So you're right. At the end of the day, we're all have the ability to be infected with the virus, and everybody's going to have a different outcome. And so our job is to make sure that if people don't get infected, but if people do get infected, that we've given them the best information based off of real world experience and through Dr. Rowland's.
Absolutely, Doc. And so many people reach out to PETA, to you directly, but to me, and they're asking, or they're sharing, like, I got COVID. What do I do? What do I do? What do I do? And when you and I both were watching that, kind of those questions kept coming in more and more and more, especially since early December. And then here we are now having this conversation. It was a little different telling what you do from a perspective of, observation. But now we can really talk about what you do from the experience. And so with that being said, I know we'll go on and continue to talk about this, but do you have anything to add to that? What do you do?
Well, I mean, what you do is, I think it was surprising that when I did the Roland Martin show, I was sicker than a dog.
You were sick, dog.
He had no idea, nobody on the idea, but I pushed on through. My NPR program, I was sick. I pushed on through. That's the type of person I am. When I did the pastures in Albany, I was sick, but I pushed on through. But that's the type of person I am. And if I had any value, is to learn from my experience, build upon my experience, and become better to protect yourself and understand that this is not a game. And even Dr. Rowland can have an infection. And I have been affected by diseases. I'm mortal too. I've been infected. I've been bit by mosquitoes and all types of stuff. But I know the experience, and going through the experience gives me the best information to provide for you to save your life.
Doc, this has been quite an experience. I'm so glad that you decided to share this. And I know that, our viewers will be like, what in the hell is going on? And the good thing about all of this is that you've beaten it. You're recovering, you're post-COVID, like you're in a post-COVID phase, trying to get everything back together. And of course, we know that it takes time to recover,
Right.
but you're doing very well. So good to see you back up and moving about. And I know we'll be going live soon to
Yeah,
really allow people to talk with you about this as well. So is there anything you want to say as we end and wrap up this particular conversation today?
not really. We have a long ways to go. There are new mutations coming down the pipeline. We found out there's 9 new coronavirus out there. There's over 132,000 RNA viruses and stuff. We have a long ways to go, and I'm gonna still be that stewardship person, representing the people, giving the people the information they need based off of my experience in real life time. And that's
We
about
love it.
okay.
We love it. We appreciate you. We appreciate it. I'm so glad that you're doing better. And we just continue to move forward. We are going to continue to work to get people to the other side. And I'm so
Absolutely.
glad to be on this journey with you.
Thank you very much, Queenie, and you get a shout out to everybody.